Your organization does not have access to Claude. A woman drank 4 gallons of pickle juice in 1 week to cure her muscle cramps. Within 5 days, she would be fighting for her life in an intensive care unit, undone by the very cure she trusted. KM is a 28-year-old woman, an otherwise healthy recreational runner who loved her morning jogs through her neighborhood. But lately, something was wrong. After every long run, her calves would seize, painful cramping that wouldn't stop. Stretching didn't help, rest didn't help. She needed a solution. So she did what millions do when faced with a medical problem. She searched the internet, and she found her answer. Pickle juice stops muscle cramps. Multiple websites confirmed it. Athletes swear by it. Football players chug it on the sidelines. It made sense. Pickles are salty, salt is an electrolyte, cramps come from electrolyte loss. Therefore, more pickle juice equals fewer cramps. Simple logic, harmless home remedy. KM started drinking pickle juice. Not a sip before a run, not a cup after exercise. 8 to 10 cups every single day, more than 2 liters. If a little works, more must work better. She filled mason jars with the translucent green liquid from pickle containers and kept them in her refrigerator, morning, noon, and night, for 1 week straight. On day 6, her husband found her convulsing on the bathroom floor. KM, a 28-year-old woman, presenting to the emergency room. Severe, unquenchable thirst despite constant drinking. Profound confusion and difficulty concentrating. A witnessed tonic-clonic seizure. Her body locked rigid for 15 seconds, then thrashing movements she couldn't control. This is what happened to her brain. The ER team moves fast. Seizure protocol, IV access, lorazepam to stop the convulsion. Vitals are concerning. Blood pressure 158/95, elevated, where hyper means above and tension refers to arterial pressure. Heart rate 112, tachycardia, tachy meaning fast and cardia referring to the heart. Her hands are swollen, her feet are swollen. She's gained 7 pounds in 5 days, but she's still desperately thirsty. The attending physician orders a basic metabolic panel, blood chemistry. The results come back from the lab, and one number stands out. Serum sodium, 168 millimoles per liter. Normal range is 135 to 145. Blood work revealed a number that made the ER physician go pale, 168. Hypernatremia, hyper meaning above, nature from the Latin natrium meaning sodium, emia meaning presence in blood. Too much sodium in the bloodstream. But 168 is not just high, it's dangerously high, it's brain-damaging high, it's seizure-inducing high, and it explains everything she's experiencing. The team starts treatment, IV fluids. They need to bring her sodium down, but then someone stops them. The nephrologist arrives and delivers devastating news. They cannot simply dilute her blood with water. If they correct her sodium too quickly, they will kill her. Not might. Will. The very fluid meant to save her could trigger catastrophic brain swelling within hours. Here's why. When serum sodium rises, it creates an osmotic gradient. Osmotic from the Greek osmos, meaning impulse or push. Water in the body always flows toward higher concentrations of dissolved particles, trying to equalize. So when the sodium outside brain cells climbs to 168, water gets pulled out from inside the neurons. The brain cells shrink. They dehydrate like raisins. But the brain is not defenseless. Over several days, KM's case, neurons respond by generating idiogenic osmoles. Idio meaning self or one's own, genic meaning producing, osmol referring to osmotically active particles. The cells manufacture organic compounds, taurine, glutamate, inositol, to increase their internal concentration, fighting back against the gradient. This protects them from shrinking further. It's a survival mechanism. But now those osmoles are trapped inside. If doctors rapidly flood her bloodstream with water, suddenly the concentration outside drops. The gradient reverses. Water rushes into the cells. The shrunken raisins try to become grapes again. But they cannot expel those protective osmoles fast enough. The cells swell. They swell beyond their normal size. In the rigid skull, there's nowhere to go. Cerebral edema, swelling of the brain, causes herniation, death, or worse, osmotic demyelination syndrome. The explosive re-expansion ruptures myelin sheaths, the insulation around nerve fibers, permanent brain damage, locked-in syndrome, quadriplegia, a fate some would call worse than death. The doctors are terrified to treat her. But what caused this? KM is young, healthy, no diabetes, no kidney disease, no medications that affect sodium. The attending physician asks the husband, "Has she been vomiting?" "No." "Diarrhea?" "No." "Excessive sweating?" "Normal summer levels." Then one detail emerges. She's been drinking something. A lot of something. The husband retrieves one of her mason jars from home. Pickle juice. How much? 8 to 10 cups a day, for a week. The physician does the math. 1 cup of typical pickle brine contains 2,400 milligrams of sodium, an entire day's recommended limit in a single cup. She's been consuming 19,200 to 24,000 milligrams daily, 9 to 10 times the recommended maximum. Each cup contained an entire day's sodium limit. She was drinking 9 days' worth every 24 hours. Understanding this case requires understanding how the kidneys handle sodium. And to understand what went wrong in KM's brain, we need to understand what doctors feared would happen if they tried to save her. If you found this case compelling, subscribe. New medical case studies are uploaded regularly. Subscribe to find out how doctors walked the razor's edge between two forms of brain death. A differential diagnosis is made. Differential, meaning to differ. Diagnosis, from the Greek diagignoskane, meaning to discern or distinguish. To find the difference among the possibilities. Could this be primary polydipsia? Polydipsia, from poly meaning many, and dipsia meaning thirst. Psychogenic water drinking. Some psychiatric patients drink excessive fluids, sometimes gallons per day, leading to altered mental status and seizures. It fits: excessive drinking, confusion, seizure. But primary polydipsia causes hyponatremia, not hypernatremia. Hypo meaning below. Drinking too much water dilutes the blood, dropping sodium to dangerous lows, sometimes below 120. KM sodium is 168, the opposite problem. She's drinking a hypersodic fluid, one loaded with sodium, not depleted of it. Primary polydipsia is ruled out. Could this be diabetes insipidus? A condition where the body cannot concentrate urine, leading to massive water loss and intense thirst. The word diabetes here means siphon, implying fluid passing through the body. Insipidus means tasteless or bland, as opposed to diabetes mellitus, mellitus meaning honey sweet, referring to sugar in the urine. In diabetes insipidus, patients can urinate 10 to 20 liters per day, becoming desperately thirsty. It could explain her thirst. But diabetes insipidus produces dilute urine and typically causes hyponatremia, or normal sodium, not hypernatremia. KM's urine is concentrated, dark, and small in volume. Her kidneys are desperately trying to hold on to water, not losing it. Diabetes insipidus is ruled out. Could this be SIADH? Syndrome of inappropriate antidiuretic hormone secretion, where the brain releases too much vasopressin, causing the kidneys to retain water even when the body doesn't need it. Blood becomes diluted. Seizures can occur from the resulting brain swelling. But SIADH causes severe hyponatremia, often below 125, the opposite of hypernatremia. SIADH is ruled out. Could this be Addison's disease? Adrenal insufficiency, named after Thomas Addison, the 19th century British physician who first described it. The adrenal glands fail to produce enough cortisol and aldosterone. Patients develop intense salt cravings, their bodies literally craving what they're losing. But Addison's disease typically presents with hypotension, low blood pressure, hyperkalemia, high potassium, and hyponatremia, low sodium. KM has hypertension and hypernatremia. The pattern is wrong. Addison's disease is ruled out. The timeline offers a clue. KM's symptoms developed over 5 to 7 days. This is chronic hypernatremia, not acute. Acute hypernatremia develops in less than 24 hours, usually from sudden sodium loading or water deprivation, as might occur in a desert survival scenario or a child force-fed salt. Chronic hypernatremia unfolds over days to weeks. The timescale heuristic helps here. Seconds suggests vascular, stroke, embolism. Hours to days suggests infection or inflammation. Days to weeks suggests metabolic or toxic exposures. Years suggests cancer or neurodegeneration. KM's case falls in the days to weeks window, pointing toward a chronic toxic or metabolic process. And ironically, the chronic onset saved her. If her sodium had spiked to 168 in a few hours, she would have suffered catastrophic brain damage. The neurons wouldn't have had time to generate protective osmoles. They would have shriveled by 15 to 20%, irreversible damage, coma, death. But the gradual rise over a week gave her cells time to adapt. It's why she was still conscious enough to seize, rather than already brain dead. The diagnosis was hiding in plain sight, in the translucent green liquid she'd been pouring down her throat. But here's the crushing irony. Pickle juice actually does stop muscle cramps. The internet wasn't wrong. But the reason, the mechanism, was completely misunderstood. And that misunderstanding almost killed her. In 2010, Dr. Kevin Miller at North Dakota State University set out to test the pickle juice phenomenon scientifically. Miller's team induced leg cramps in dehydrated athletes using electrical stimulation. Then, they gave the athletes one of three things: 2 ounces of pickle juice, 2 ounces of water, or nothing. They measured how long the cramps lasted. The results were stunning. Pickle juice stopped the cramps in 85 seconds. Water took 134 seconds. The difference was statistically significant. Pickle juice worked. But the discovery that shocked Miller was this: it worked too fast. Way too fast. Here's why that matters. If pickle juice stopped cramps by replacing sodium or electrolytes, the sodium would have to be absorbed from the stomach into the bloodstream, circulated to the muscles, and corrected the supposed deficiency. That process takes at least 30 minutes. But the cramps stopped in 85 seconds, faster than the sodium could possibly be absorbed. Miller proposed a radical alternative. The pickle juice wasn't working because of what it contained. It was working because of where it went. When pickle juice hits the back of the throat and the esophagus, the acetic acid, vinegar, triggers TRP channels, transient receptor potential channels, a class of sensory receptors that detect chemical irritants. TRP from transient receptor potential. These channels, when activated by the sharp acidity, send a signal to the brainstem. The brainstem sends an inhibitory signal back down to the alpha motor neurons in the spinal cord. Alpha motor neurons are the nerves that tell muscles to contract. The inhibitory signal tells them to stop firing. The cramp releases. It's a reflex, a neural circuit. It has nothing to do with sodium. 1 or 2 ounces, a single sip, is all you need. The effect is mechanical, not metabolic. KM didn't need 4 gallons. She didn't need 8 cups a day. She needed a sip, maybe 2 ounces before a run. Instead, she drank 9 times the recommended daily sodium intake for a week, poisoning herself with the very element she thought she lacked. But the story gets darker. Because the danger of correcting hypernatremia too quickly wasn't always known. It was discovered through tragedy. In 1959, 3 neurologists at Massachusetts General Hospital, Dr. Raymond Adams, Dr. Maurice Victor, and Dr. L. Mancall, described a horrifying pattern. Patients admitted with severe hyponatremia, low sodium, often from alcoholism or malnutrition. They were treated with IV saline to raise their sodium. The sodium normalized. The patient seemed to recover. Then, days later, they deteriorated. Profound weakness, difficulty speaking, difficulty swallowing. Some became locked in, fully conscious but unable to move or communicate, trapped in their own bodies. Quadriplegia, death. Autopsies revealed the cause. In the center of the brainstem, in a region called the pons, The myelin sheaths around nerve fibers had been destroyed. Demyelination. D meaning removal, myelin referring to the fatty insulation around axons. Central pontine myelinolysis. Central meaning in the middle, pontine referring to the pons, myelinolysis meaning destruction of myelin. The mechanism was osmotic. When sodium drops, brain cells generate idiogenic osmoles to prevent water from flooding in. If sodium is corrected too fast, the osmotic imbalance reverses explosively. Water rushes into the cells swell. The sudden expansion physically rips apart the myelin sheaths, like overfilling a balloon until it bursts. The damage is permanent. The same phenomenon occurs in reverse. With hypernatremia, KM's shrunken brain cells had spent a week generating emergency osmoles to survive. Rapid rehydration would make them explode. This is what happened to KM. The nephrologist calculates the correction rate with precision. Maximum sodium reduction of 10 to 12 millimoles per liter per 24 hours. Any faster risks demyelination. KM's sodium is 168. Goal is 139. That's a 29-point drop. At 8 to 10 points per day, it will take 3 full days to safely normalize. They start an IV infusion of 5% dextrose in water, D5W. Dextrose meaning glucose, a sugar that cells metabolize, leaving behind free water. The free water dilutes the blood sodium, but it must be given slowly, continuously, with hourly sodium checks. If the sodium drops too fast, they stop the infusion. If it's not dropping fast enough, they adjust the rate. In the first 24 hours, they aim to lower her sodium by exactly 8 millimoles per liter, from 168 to 160. No more, no less. It's a razor's edge. Too slow, and her brain remains shrunken, at risk for hemorrhage as shriveled blood vessels tear. Too fast, and the rebound swelling destroys her brainstem. Hour by hour, they monitor. Sodium at hour 4, 165, on track. Sodium at hour 8, 163, good. Sodium at hour 12, 161, holding steady. At hour 24, her sodium is 160, exactly on target. Day 2. They continue the infusion, slower now. They aim for another 6 to 8 millimoles per liter. By hour 48, her sodium is 153, still descending, still controlled. Day 3. Her mental status is improving. The confusion is lifting. She recognizes her husband. She can answer questions. Her sodium is 146, almost normal. The muscle twitching has stopped. The swelling in her hands and feet is resolving. Day 4. Neurological exam is completely normal. Sodium is 142, within normal range. They stop the IV dextrose and transition to careful oral hydration. She's eating. She's walking. The crisis is over. Day 5. She's discharged. Sodium is stable at 139, completely normal. The doctors warn her, never drink pickle juice in those quantities again. Never trust internet health advice without understanding the mechanism. She nods. She understands. She almost died from a home remedy. 6 months later, her brain MRI is completely normal, but the lesson extends far beyond pickle juice. Muscle cramps, in most cases, are not caused by electrolyte deficiency. They're caused by neuromuscular fatigue. When a muscle is overworked or dehydrated, the nerve signals controlling it become erratic. The muscle contracts involuntarily. Sodium, potassium, magnesium, these can play a role, but usually only in severe systemic depletion, like marathon runners who've lost liters of sweat without replacing fluids. For the average person with post-exercise cramps, the solution is simple. Stretch the muscle, hydrate with water, rest, or, if you want to use pickle juice, use it correctly. 1 or 2 ounces, a single sip, just enough to trigger the TRP channel reflex in your throat. That sip sends the neural signal that stops the cramp. You don't need to drink it. You barely need to swallow it. The reflex happens in the oropharynx. But KM didn't know that. She thought the benefit came from the sodium. So she drank more, and more, and more. Each cup delivering 2,400 milligrams of sodium. The recommended daily limit is 2,300 milligrams. That's about 1 teaspoon of table salt. 1 cup of pickle juice meets or exceeds your entire daily allowance. She drank 8 to 10 cups a day. The kidneys can excrete excess sodium, but only to a point. A healthy kidney can excrete roughly 10 to 15 grams of sodium per day if you're drinking enough water to produce urine. But if you're drinking a hypersodic fluid, the sodium overwhelms the system. Serum concentration rises. Water gets pulled from tissues into the bloodstream to dilute it. Blood volume increases. Blood pressure rises. The heart works harder. The brain shrinks. Chronic sodium excess doesn't just cause hypernatremia. It causes hypertension, which damages blood vessels over decades. It increases stroke risk. It accelerates kidney disease. It contributes to heart failure. The body is not designed to handle 20,000 milligrams of sodium per day. If you experience persistent muscle cramps, see a doctor. Don't self-treat. Underlying causes include hypothyroidism, low thyroid hormones slowing metabolism and muscle function, peripheral artery disease, reduced blood flow to the legs causing claudication, pain with exercise, medication side effects, statins, diuretics, and blood pressure drugs can all cause cramping. Neurological conditions like ALS or peripheral neuropathy. A proper evaluation with labs, imaging, and medication review can identify these. And when you encounter health advice on the internet, ask why. Don't just ask if it works, ask why it works. Understand the mechanism. Pickle juice stops cramps because of a neural reflex triggered by acid in the throat, not because of sodium in the stomach. That distinction is the difference between a 1-ounce sip and a 4-gallon overdose. KM recovered fully. Her brain returned to normal size as her sodium normalized. The idiogenic osmoles her neurons generated were slowly degraded and excreted. The swelling in her hands and feet resolved as her blood volume normalized. The blood vessels in her brain, which had been stretched by the expansion of blood volume and compressed by the shrinking of brain tissue, returned to their usual shape. 6 months later, she runs again. Rarely she gets a cramp. When she does, she drinks water. She takes a magnesium supplement. She stretches. The cramps resolve. She learned the lesson the hardest way possible. More is not always better. Natural is not always safe. And a home remedy, no matter how widely recommended, can kill you if you don't understand why it's supposed to work. Thank you for watching. Take care of yourself and be well.